Hello, I'm Dr. Shauna Eischens
And I'm Dr. Thomas Kruzel.
from Rockwood Natural Medicine Clinic. As naturopathic physicians, we are always striving to improve and increase overall health, but today we wanted to talk vaccines. Dun dun dun. Vaccines can often be this dreaded, heated debate, and it really doesn't have to be. It can come down to educated choices, respect, communication, and really honoring where people are at because everyone's so different. So today we want to talk about empowered choices, educating yourself, discussing how we really want to include safe and effective treatment as well as safe and effective treatment options in prevention of disease, and also advocate for truth. So let's talk about this continuum that we made up. And if you'll notice at the bottom, it shows proper medical care and nutrient-rich diet. That's a foundation that we really should all be doing. And this means the more antioxidants, the more fruits and vegetables we're eating, the less likely we are to get sick, and then the faster we will overcome illness. Breastfeeding is also included in that topic. We understand that not all women are able to do that, not all children are able to benefit from that. So no judgment if that is you, but of course those immunoglobulins are incredible, especially in the first 6 months of life. Proper medical care includes if you are sick or healing quickly, definitely see your physician. On this side here, you'll see this red die. What that signifies is nothing. You're gambling, you're rolling the dice and going, oh, we'll see. If I get this disease, So you're not vaccinating, you're not eating well, maybe eating a very poor diet, not receiving proper medical care, not including any of the no-sods that Dr. Kruzel will talk about. So this is really a gamble. We do not recommend this option here. Take your dice to Vegas or on game night, not with your health. Here, as you may be able to see, it discusses, or he's going to discuss, homeopathic no-sods. So I'm going to skim over that and let Dr. Kruzel talk more in detail about that. And then we have a combination here, homeopathic no-sods and vaccination. And then delayed or partial schedule, meaning you don't necessarily have to do all the vaccines at the same time at that designated time frame. It may take you some more time to research what is best for your children or yourself, and that option to spread them out or maybe even just do one at a time if that's the best option for you is an option. And then up here there's full vaccination, which most people are familiar with. And then this one, both sides of the spectrum we do not recommend. As you may be able to see, it's a little Tylenol bottle. We're not out to pick on Tylenol, but Tylenol is the product that most people think of when they think of acetaminophen. So this is actually acetaminophen. But what that does is it depletes something, our master antioxidant called glutathione. We want and need glutathione. And what happens is when people take, usually it's parents giving their child Tylenol either before or right after vaccination, possibly because of a fever, what that does is it depletes glutathione, which means the body is unable to rid the toxicants as efficiently and effectively. So like I said, we don't recommend doing absolutely nothing and eating poorly and not receiving proper medical care, and we don't recommend vaccinating or fully vaccinating and giving acetaminophen at the same time. So Dr. Kruzel can talk a little bit more about these two options here.
So nature has designed us to attenuate viruses through the oral nasal route. We basically have a large amount of lymph tissue in this part of our body because this is where viruses and bacteria enter the body. So as an example, a child who's exposed to chickenpox, they do not develop a skin rash until 4 to 7 to 10 days following exposure to the virus. The purpose of that is for the immunoglobulins and the lymphoid tissue to attenuate the virus in an incremental manner so that by the time it reaches into the child's system and comes out as a skin rash, they have full immunity to this virus. Contrast that with conventional immunizations which enter the body through the skin. This basically bypasses the T and B lymphocytes that are in abundance in the nasal and oral mucosa and bypasses them in order to set up immunizations. One of the problems with this, of course, is that the body recognizes these as foreign agents and quickly gets rid of them. So in order to attenuate the virus, attempt to attenuate the virus through conventional vaccinations, they add adjuncts to them. Adjuncts are things like mercury and thimerosal and other types of substances which can cause some adverse reactions. And there's a huge body of literature now that supports that these adjuncts do end up causing autoimmune types of diseases later on in life. So one of the reasons that we advocate using the homeopathic nosodes is because they are developed similar to what the virus in the natural environment is like. So what happens with this is we will take, the pharmacies will take the nosode, they will make a homeopathic medicine out of it, and we use them in the 200C potency, and it goes in through the oral nasal route. The same thing happens that way with the nosode as it does with exposure to the virus in the environment, except that the immune system doesn't react to the adjuncts because there are none in there. What it does do is impart cellular memory to the T and B lymphocytes so that when the child is exposed later on in their life to chickenpox or measles or mumps, they already have developed some type of immunity with it. The reason our program works so well for kids, and we've been doing this for well over 30 years now, is because they get the nosodes every year for the first 12 years of their life. And the studies now are showing that repeated doses of these nosodes actually impart strength and vigor to the system so that they're less likely to develop these types of diseases. It's much safer and much more effective than conventional immunizations. And we unfortunately see many kids who have had adverse reactions to conventional immunizations, which is something that we also deal with as well.
And another thing we like to consider is the risk-benefit ratio, right?
That's correct.
So it's not a black and white issue. So many people think, oh, I would never vaccinate, or of course, I have to fully vaccinate, otherwise I'm going to die from all these deadly diseases. Right. Really, there's a big discrepancy and disparity between, say, influenza and meningitis. So oftentimes we educate patients on what is the risk-benefit ratio, disease versus what we're able to do to treat the disease versus prevention of the disease. Do you have anything to add about that?
We also talk to our patients about the various types of conventional vaccinations and what the risks of them are. Certain types of vaccinations, such as the influenza vaccine, have been shown over a period of years to actually increase the person's risk of developing flu and other types of autoimmune disease. So we're very cautious about what we recommend to our patients, and again, it's parental choice here. In the state of Arizona, everyone does have that choice. And if the parents decide that they want to use conventional vaccinations, we will support them with that, but we also provide them with homeopathic medicines to cut down on the chances of their children having an adverse reaction. If your child does have an adverse reaction, we also have a number of therapies that can help them through that, and if for some reason they have been damaged by vaccines, we have a program in place to reverse that damage.
So what we really want to accomplish here is to make this less of a black and white yes-no issue and let you know that you have choices. This is a personal thing, personal decision for you and your family, and it doesn't have to be an all or none. So please be respectful of your peers, your colleagues, your neighbors, and everybody's really doing the best they can and trying to make the best choices for their children. So hopefully you learned something today, and may you come rather from a place of fear, which is never beneficial for any decision, but rather a place of education and empowerment.